Monday. Red Polly.
Dusty.
Blue Poncho.
Tupac.
Street.
Hey, Wilson Hoosier. Hey, Elvis.
Dre. 58.
Go.
All right, everyone, welcome to Health Matters. We're here to talk to you about the NFL and how health is going to affect your player and your team. We got a great group here today. We got Ryan Whalen helping me moderate. We got Brandon Albin and Tyler Zajac who are going to take us through a bunch of really cool topics. We're going to talk about your fantasy top 4 do's and don'ts. We're going to talk about the recent PUP list and some of the players that may become available for you here pretty soon. We're going to do a little bit of an injury roundup as well. And then we're going to lead off with some introduction on what's going on here in the AFC East. So, Ryan, Health Matters. What's going on in the AFC East?
So the AFC East has seen so much going on this offseason, from Dalvin Cook signing with the Jets and along with Aaron Rodgers, Zeke just signing with the Patriots. But one of the biggest news stories we have coming from last season is Damar Hamlin coming back from his cardiac arrest that he suffered on the field. We've been thinking about Damar Hamlin this offseason and the scary situation that unfolded last year in Buffalo. We want to tip our hats to the athletic trainers, the medical staff, everyone that helped him along the way to be able to get back onto the field this last week and be back on the field with his brothers, back competing. And we're hoping for the best for him this season, that he'll be able to start playing in the regular season.
Yeah, I just want to give a huge shout out to the medical staff and everyone that was just doing incredible work. And they were recognized at the ESPYs. Incredible. They got a great award, and this was really cool and extremely well-deserved for being prepared. And you do all this training and hope something never happens, like what happened to Damar Hamlin, but you're ready on the field just in case it happens. And the hours and hours and hours of medical training, scenarios, knowing the emergency action plan was perfectly demonstrated by what the Buffalo medical staff did. So kudos, congratulations on your recognition with the ESPYs. But it looks like he's already back at camp, right?
Yeah,
he played in the preseason game. He played really well too. He got in on a few tackles. Goosebumps seeing him back out there.
Yeah, going into that, what do you think he did to get back, Tyler? I mean, being an athletic trainer back on the field, what kind of conditioning level you think he had to get back to before they would clear him?
Oh, I don't need it. You want to think about what they had to put him through for that. I mean, your normal injuries take months and months, just your orthopedic injuries. For something like that, you have to add all of that in on top of all of the labs. I'm sure he had heart monitors on him left and right. Everything he had to do to get back, it had to take, I'm sure he was in that training room in the hospital getting checked up on a ton. Doc, you could probably speak more to that on what they're probably doing on the back end.
Heavy of tests, Tyler, that Damar has most likely gone through. I don't have all the details, but he's gone through a number of tests to assess his suitability for play. And, fortunately he has come through those tests with probably flying colors. And, there's always a risk discussion, when a player has a very big injury like that about when you're going to come back. And it can be scary at times. And, I've had those discussions with players. I know Brandon and Tyler, you probably had those discussions in the athletic training room. And it can be daunting. You're on your such and such concussion. You're on your 5th knee injury and 3rd knee surgery. And, not the least of which you got a major cardiac event with Damar. It's scary. But you want to have those discussions with a player and give the player the information, get their agent involved, get their family involved, get the team, the doctors, the physicians do an amazing job. And that's an important part of the entire return to play decision-making analysis. And so he's gone through all that, guaranteed.
Definitely. Yeah. And another thing in the AFC East, looking at the Dolphins and Tua, who had another major multiple concussion season, and now he's back on the field, and it's the same process going through with the docs, the clearances, and these aren't, original orthopedic injuries. These are different. It's kind of a new world in the AFC East with that. What do you think on that, Tyler?
That's a great point. It seems like it's just the AFC East, but concussions, they were a big deal all of last year. And obviously Tua was the start of that. I think they did the right thing, keeping him out at the end, letting him recover. And I think, there was probably some pressure from the outside as well, but I think the NFL, obviously they came through and tried to change up some of their concussion protocol. Doc, you know how many eyes and ears are all over the field and eyes watching for that type of stuff. But, they did what they had to, and to see him come back out, to see him want to take the field and keep playing and keep pushing is huge at the end of the day. And we know some of the staff out there and on the Dolphins down in Miami, and they are top notch. There's some of the best athletic trainers I've worked with. Their head athletic trainer before, and it's one of the best athletic trainers I know. So, couldn't have a better staff behind him, and just happy to see him back on the field.
Definitely, yeah, that's good. Now, let's take it to Ryan for a little Pats preview. He's the Pats fan in the room. Let's hear from him.
Yeah, so the Patriots, they just had a huge signing this week in Ezekiel Elliott, which could potentially shake things up in that running back room. Now we've got Ramondre Stevenson as our main running back. Damian Harris just joined division rival, the Buffalo Bills, of course. So we got to wonder, who's going to take the heavy load this year? Will it be Ramondre Stevenson? Will it be Ezekiel Elliott in the backfield for the Patriots? Potentially could have.
I look at it as a 1-2 punch there. I think if you can tire out a defense and then, with, let's say, Zeke and then put in Ramondre or vice versa, that's a big help to an offense that, to be honest, really needs it. Their wide receiving core isn't exactly what everyone, I think that's a Pats fan, was probably hoping for this year. There was a few guys out there that they were eyeing, weren't able to sign. So I think being able to bring a veteran like Zeke in there and pair him up with someone like Ramondre, who obviously did fantastic last year, is a huge benefit to a team that really needed some positive energy right now on the offensive side of the ball. Their defense looked great last year. They, I think they're still pretty stacked, but the offensive side definitely needed a little something to get going. And I'm hoping this is what it needs.
Yeah, Tyler, speaking of offense, the resurgence of the Hard Knocks team, the Jets, bringing in Aaron Rodgers and Dalvin Cook, really trying to beef up that offense. That looks like it's going to be a fun team to watch.
They also got some drama going around in their running back room too, with Breece Hall just coming off of the PUP list this week, right after the Dalvin Cook signing. So what do you guys think will be going on in that running backs room?
That's a little bit of a different situation the way I see it. Zeke had some injuries last year, and Ramondre, he had a couple little things, but was able to play through the whole year. The Breece Hall, Dalvin Cook situation is a little bit different. You have Breece coming off an ACL his rookie year. He had 463 yards his rookie year, was playing really well, had a touchdown in the last 4 games that he played before his injury. But coming off an ACL isn't an easy task. You have to get back into game shape, game speed, especially having that ACL as a rookie. He didn't really have, obviously, that full rookie season to even get into that. And obviously he looked good when he was on the field. And Dalvin Cook, he's coming off shoulder surgery, let's not forget. So neither one of them is 100% going into this year. Breece Hall, which we'll get into a little bit later, just got released from PUP. Dalvin Cook has fought through these injuries. He has 4 years of 1,000-yard rushing seasons. But for those two, it's a little bit different. I think they'll do well, but I think it's going to take a few games to really get into the swing of things. Doc, Dalvin Cook, shoulder, Breece Hall, ACL. Yeah. What are your thoughts on that?
Yeah, well, they're night and day in terms of being able to recover and come back. And you can play through a shoulder labrum injury or shoulder instability or shoulder dislocation. You can play through it. Can you damage it more? Sure. Can you damage more of the ball and socket joint? There's structures there that we're always looking at, such as the labrum and the bone and the socket of the shoulder. But you can play through it. And there's some really good ways. You got ways that our athletic trainers help you through with some special straps and braces and Sully braces and other things that help you limit your rotation. Can be a little bit hard, especially in a skills position player, to catch and get your arm in that really abducted external overhead position where you need to be to grab that ball out of the air. So you want to have a stable shoulder joint at the end of the day, but it's night and day in terms of recovery. The shoulder instability, and even after coming off a labrum surgery, you're looking at 4, 5, 6 months back to full activities, depending on how you rehabilitate all of the other muscles around the shoulder, which are the most important stabilizers, in fact. An ACL injury, especially in a skills player, is very hard to come back in, even at 9 months. And so by 9 months, you're starting to ramp up your activities, but we've seen plenty of ACLs that have taken much longer than that, especially in the NFL. And then what we see with that, and our stats at the predictors.com, which suggest this as well, is running backs about 27% down in snap percentage, about 30% down in overall offensive performance their first year back. Now, the good news is, for those who are looking at ACL injuries in certain skills positions, especially running back, is you've got the ability to recover that pretty well by your second year back after the ACL tear.
Interesting. So this isn't the year for the Breece Hall output.
Yeah.
You're saying draft. If you're going to draft him next year on your
Yeah,
fantasy
maybe
team.
next year. Maybe, we'll see how he does. The season could warm up for him, and maybe by week 6, 7, 8, he's really starting to show his stuff. It's interesting. You look at Zeke's stuff, and again, our data from the predictors. He, like you said, Tyler, he's had a few injuries along the way. He's had some, rib contusions, hamstring, calf, but really what took him out for a few weeks last year was an MCL injury to his knee, and he really wasn't the same Zeke in the second part of the season. He had a much less snap percentage. I mean, of course, that could be coaching decisions, but he had much less snap percentage in the 40s and 50s for most of the season. He had less time, less offensive productivity. And if you look at last year for Zeke, he had a pretty good season. He had 60, 70% snap percentage, some games at 50, but he had much decreased offensive production in the second half of the season. So, back to the Patriots, they're going to need a 1-2 running back. And maybe it's a 1A, RB1A, and RB1B at the end of the day, because, Zeke, hopefully in the offseason has given him some time to get this knee better, and his calf, his lower extremity. He's got a bunch of things going on there, and they're probably all linked on some level. But we should see him back praying pretty well. And I would say something in that 1A, 1B, or 1-2 situation for the Patriots.
Definitely, yeah. And speaking of the drafting, moving on to the fantasy world, the do's and don'ts, Zeke leaving the Patriots, brings up an interesting question for Tony Pollard. Ryan here, he has Tony Pollard on his do draft list, where I have him on my don't draft list because he's coming off that ankle surgery. Even though he's going to get a bigger load, how does that play into effect? What do you think on that, Ryan?
Obviously with Zeke leaving, that's going to give so much more of the load to Tony Pollard. And on top of that, too, they just signed Zach Martin back as well. They just signed him to a nice deal. So they're bolstering up that offensive line to protect him so he can get as many rushes as he can without getting hit early. Just keep on running, have the offensive line open up the hole and have Tony Pollard just hit it and keep going.
Yeah. Tyler, what about you? Get a little athlete trainer's perspective on where you putting Tony, do or don't draft.
That's a good question. I like Tony Pollard. I am a little worried on the ankle. That's for sure. Anytime a running back is dealing with an ankle injury, we saw it with Christian McCaffrey when the load was placed on him. And I mean, he's an unbelievable athlete, obviously. Even that when he was in Carolina and he had that ankle issue, a lot of issues there, a lot of problems coming back from it until he had a good amount of time to rest it. I think the offseason helps a bunch. If the Cowboys can come up with an offensive scheme that allows Dak to pass the ball and they get good passing options. They don't have too many injuries there, and they can scheme it out where Tony Pollard isn't consistently running the ball over and over and over and over again. I think they'll be okay. I like Tony Pollard. I like him as a fantasy draft option. If they overuse him, kind of like they did Zeke, then I think he's going to have an issue this year, and I think we see him miss a few games.
Got you. Yeah, that's good stuff. Speaking of passing game, who do you got on your receivers for the do draft list?
Ooh, For on my do draft list, I have Keenan Allen on there, and that is a interesting, I know, pick, as we do love injuries here. But I know Keenan Allen had a lot of time off at the beginning of the season last year for his hamstring, sat out weeks 2 to 6, came back, got 11 yards in game 7, then sat out the bye week in 2 more games. But after that, he went on to have almost 700 yards in his final 8 games. I think it was like 670 or 675, something like that. And he's still the number 1 wide receiver on the Chargers. He has Justin Herbert throwing to him, great quarterback. They have Mike Williams there for, fade routes, things like that in the end zone. So I like Keenan Allen. I still like Keenan Allen despite the hamstring injury last year. I think he can stay healthy. He's 31, so from an NFL standpoint, he's getting up there in age, but I think that he's still going to provide some good production in the fantasy world, and I think that's a good choice.
Yeah, Doc, what do you think on that?
Yeah, he look at our data. Keenan's a great player, and he's been able to get through it. But hamstrings are tough, and he is demonstrating what we see in the league consistently with a player like him, who's an outstanding player. But this goes back even to 2019, and if not prior, where he had a hamstring in 19, another one in 2020. Unfortunately, he did not have one in 2021, but 2022 is when he really missed that massive amount of time with the hamstring. And so you can see that there is a re-injury rate that we show in the wide receiver core. And our data, the predictors, again, shows that you have this re-injury rate that can be up to 18 to 22%, especially as you have multiple hamstrings. And so I would expect him to be on the injury report at some point this year with another hamstring.
Yeah.
Ooh,
Definitely
you're giving him the Julio Jones treatment there, Doc.
Another
It's
guy
the
I
data.
like.
It's the data, Tyler. I mean, I don't know what to tell you. It's it goes back 4 or 5 years, and it's the data. He's a great player. Love him not to get a hamstring. These are really tough injuries. It's not just a classic little ache back there, but they impede performance. They undergo a lot of tissue changes in the muscle. You get fibrosis. You get all these other things going on that makes the muscle more prone to re-injure again. And it's just the fact of life, unfortunately, of the hamstring in the NFL.
Definitely.
Brandon.
Yeah, the guy I like receiver-wise is Chris Olave, who did have a hamstring in college but seemed to fight through it a bunch. And he's got a new quarterback throwing him the ball in Derek Carr. Throw it a little bit deeper maybe, get a little more accuracy out of that. So I think he's going to be a good do pick. You got a little injury history on him too, Tyler, right?
Yeah. First of all, Brandon, I love this pick. I love Chris Olave as a wide receiver. Coming off his rookie year, he had over 1,000 yards receiving. He had 119 targets, which was by far number 1 on his team over there at the Saints. This year, upgrade, like you said, at quarterback. Yes, he did have a hamstring injury last year. He also had a concussion last year. But that hamstring injury, he missed 1 game, came back, grinded through the hamstring, and still was able to put up big productions even after that injury. He ended the year, I think, out of the total 15 games that he played, he was the number 1 receiver on the team on 8 of those games. So I couldn't agree with you more. And if anyone else disagrees with the Chris Olave pick, I think they're just completely wrong.
No, I definitely agree with that pick. And for those players that only miss 1 game with a hamstring injury, it's almost as if they never got injured when they return. There's virtually no difference in performance afterwards.
Gotcha. Yeah. And let's move on to a little don't action, a little change of pace. Jonathan Taylor, the running back for the Colts, who's been battling some ownership issues, a little mental health stuff, was sent home today or went home today in an excused practice. I'm taking him as a don't, even though he was a high production guy last year.
I would agree with you there, Brandon. This is hard too because he's such a talent. He obviously showed that 2 years ago. Last year, he dealt with so many injuries. And now he's got, as you said, all of the stuff he has to work through with the contract and everything in that nature. I just don't see him being a good pick right now. Listen, if you can get him later in your draft, then fine. But I'm definitely not taking him in my first round. And I'll probably skip it over in my second round, knowing what I know right now. we'll see what happens if he can start getting in the swing of things. But I'd have to agree with you on that one.
Yeah, Doc, what do you think on the mental health piece?
Yeah, you know, it's real, and the NFL, I think, is doing a great job at giving players the resources that help them be proactive about it, to deal with it in a confidential manner, to be able to really dive down and help themselves do the best they want to do. And I think it's just super important. And the NFL is doing a really good job, and all of our embedded mental health professionals that are with all the teams on top of the second opinion options. I applaud him for doing this and really taking time to help with the mental health. And, you know, you don't really know what it's truly about, but one could surmise it's, you know, he's had a lot of tough issues with injuries, and ankle and knee before that, and a high ankle, and, you know, continued to miss quite a few games after having, you know, snap percentage and offensive productivity that was really good in the middle of the season last year. And, you know, even the year before. But these are folks, especially someone like Jonathan Taylor, who's so good, so conditioned and used to being at this level, that it can take a mental toll on you if you don't have all of the assets to be able to perform like you want to do.
Definitely during a contract year too. That's the tough part.
Yeah, no, he wants to perform, and, you know, he and his agent are talking about that, of course. But, you know, he probably just wants to go out and play and do a good job. I mean, he had snap percentage in the 80s and 90s in the middle of the season. You know, last year, Tyler, he certainly wasn't a ton of games, but certainly provided some, you know, productivity for the Colts.
No, listen. He's a heck of a talent. He, like I said, he showed that 2 years ago. With the injuries, though, I'm just not taking him at last year. I'm just not taking him at the top of my draft board. Listen, if he falls a few and you can get him later, taking a chance on him, that's fine. But I don't want to look back at my fantasy draft and not see the production out of a top round draft pick that I took at the end of the day.
Definitely. Yeah. Wrapping up the don'ts. I think, Ryan, you got one more, huh?
Yeah, for me, one guy I was kind of on the edge for a while, but ultimately I'm leaning against not drafting this player. But Mike Gesicki just joined the Patriots this offseason, coming from in division rivals from Miami Dolphins. I just don't really see him really panning out too well for fantasy owners. I mean, he's a tight end, but I feel like he's going to be used more in a blocking setting. The Patriots will use Hunter Henry more so in the receiving game. And on top of that, he also just had his mild shoulder dislocation this week. So they're going to want to be cautious about that. They don't want to continue to push his shoulder too much and cause more damage with it.
Yeah, you know, Ryan, this goes back to a shoulder injury he had in 2020. You know, he actually missed a game because of it. And, you know, this is what we see with recurrent labrum tears, recurrent labrum injuries, shoulder instability events. And, you know, he's in a position at tight end. Maybe they may not use him exactly like that, but, you know, Patriots can be creative with that position. But, you know, he's a pretty darn good tight end. But this is, you know, recurrent shoulder injury, probably recurrent shoulder labrum that, you know, at least it goes back to 2020, if not before. And so at some point he's going to have to get it taken care of. Hopefully he can get, you know, taken care of enough, like the things we talked about, to help deal with a labrum injury through the season. But we'll see. I don't disagree with that. I think he might have some issues there, and might be a coaching limit as well as potentially injury limit as well.
Definitely, yeah. And shoulder instability has been a big topic today with Dalvin Cook and Gesicki. And Tyler, what's your 3 biggest things you look for in getting a player back on the field, just back in the athletic training days?
I think the biggest one is just the ability to do their job and not have pain. First of all, I want to make sure they're pain free as much as you can be, getting back onto the field. I think number 2 is their musculature around that shoulder. And obviously Doc can talk a little bit more about that. But making sure that they go through the correct rehab to, you know, use those muscles. I mean, there's 17 muscles around the shoulder there that help. And making sure that you can stabilize that joint. I mean, the shoulder is made to move, but you need the stability obviously there. And there's a lot of different structures in there that can help with that. But the muscles, definitely number 2 on my list, to make sure that they feel okay getting back out there. And then we talked about it a little bit, and this is a little bit kind of a third one is out on a limb here, I guess you could say, or a little bit different, but is the mental health aspect of it. I want to make sure that they go into a game feeling comfortable with that shoulder, that they had, if it's a surgical shoulder, as Dalvin Cook's was, that they feel comfortable that the surgery or the repair is where it needs to be, that it's going to hold up in a game situation. And if it's not surgical, that they went through the right rehab, that they feel comfortable. Like I said, they're pain-free. They have the strength there and the stability, and that they're able to get on the field and do their job and help their teammates, find success and win the game. Doc.
Yeah, Tyler, to play on that, I totally agree. And there's a battery of tests you put through, and the strength and reasonably pain-free range of motion. It might not be at the absolute extreme. You might get a little bit of a pinch as the capsule and labrum are pulled into their max tension and max length. But what you talked about, the mental side, is super important, because we actually have a shoulder outcome scale, meaning how do you do after your shoulder injury or shoulder surgery, that looks at how do you feel with your shoulder. And some of the questions on there, are you fearful of dislocating it? If you've ever dislocated your shoulder or subluxar or put it out of joint, it's miserable. You don't like it. You remember it. You don't want it to happen again. And so there's a significant mental component to not wanting this to happen again. I don't want to feel that. I don't want it to happen on the field. I don't want it to be something even worse on the field or in practice. And so that mental component is really key. And feeling the confidence with that, and confidence in your shoulder to go back, is a key element on our outcome scales as we allow players return to their sport.
Definitely, yeah. That confident shoulder is going to be Dalvin Cook coming back from his shoulder surgery, and I think he's going to fall through the pain, And so, coming off that PUP list is his counterpart or competitor is Breece Hall from the ACL. What do you think on that, Tyler? Is he going to be a guy that's going to make an impact coming off the ACL?
I think he'll make an impact. As I said earlier, I think it's going to take him some time to get up to game speed again. That injury was when he was a rookie already, so he was still trying to get into that NFL speed as it was, and then he was doing well. Like I said, 460 something yards his rookie year, but coming off an ACL is a different type of animal. It's again the mental aspect, it's the physical aspect of the muscles surrounding it. You need to make sure that you feel comfortable being able to cut, being able to do the things you need to do to help your team win. I think having Dalvin Cook, a veteran like him, in that same room, and someone who's gone through injuries before, they'll be able to talk through some of that. I think he'll be able to get over that. As Doc said, the NFL's put people in place to help with some of that. I think he'll make an impact, but if you're asking me in the fantasy world, I think there's a whole different component about that. And that's the fact that, again, they are a 1-2 punch. So how many carries is he going to get? How much production can he put up when you have a veteran like Dalvin Cook, who's had 4,000-yard rushing seasons in a row? Are you going to get the snaps that you need to help your fantasy team out? And that's also a big play in that.
Definitely. Yeah. So let's do a little injury roundup to kind of wrap things up for the day. Let's go through the week's injuries, and you let Doc comment on the one he thinks is going to be the most impactful. First we got the Giants right tackle Evan Neal. He's out right now with a concussion protocol. We got Titans wide receiver Treylon Burks carted off the field with a left leg injury.
Yeah, I think a big one is Russell Gage too for the Bucks. He's going to miss the entire season. They haven't said exactly what it was yet, but apparently he sustained it while he was backpedaling, and it was a non-contact leg injury. I know as soon as we hear the word non-contact, where our minds go, we don't like that, especially if it's season ending. Ravens cornerback Marlon Humphrey had foot surgery. They're hoping that he'll be back in around a month, but he's obviously a big staple, their best cornerback. So that's a huge impact player out. And then Micah Parsons kicked in the leg at practice, didn't return. Left practice, didn't return, but they said he should be fine. And after watching him through a groin injury last season, I don't think Cowboys fans have anything to worry about that one. I think the big ones, once we know what it is Russell Gage, like you said, Treylon Burks, his leg injury carted off, and then the foot surgery with Marlon Humphrey.
Yeah, I think we're hearing the Treylon Burks is an LCL injury, so May getting back on the field this year.
Yeah, no, Brandon, I agree with that. There, and he can potentially play through a lateral collateral ligament. It's a little bit more unpredictable than the MCL, which is your inner ligament in the knee. It really depends on the grade of it. We grade it usually 1, 2, 3. There's a grade on exam, a grade on MRI, and really depend on how this heals down. But you put this in a brace, you let it heal, you try to get them back, and then ramp it up. But it's probably a significant time period, and probably heads to IR at least, if not PUP or something else to protect that spot. It depends what the team's feeling about it on the medical staff.
Definitely, yeah. And the ACL being out a year, a guy that's a contributor, that an older guy, that could be kind of an ending of the career.
Yeah, it's tough. Russell's great player. Is drafted 2018, wide receiver. Hopefully it's waiting here, get some more information, see exactly what this is. But he's been plagued with some injuries over the last several years, including hamstring, ankle, knee, and hopefully now it's not a major ligament or something else. But there's certainly concern for that. But he's going to be a big loss for Tampa Bay.
That's a bad loss for Tampa Bay. I guess if you're drafting Mike Evans, he's about to get every target that team has. So, but that's tough.
That probably goes on the due draft list at this point.
Yeah,
Mike Evans. Yeah, exactly. But that's the dynamics. It changes. It changes every day in practice. Changes every week with all the games. We got a whole slate of games coming up here, starting pretty soon, and it's interesting.
One question I do have for you guys before we sign off here. We talked all about the AFC East today. I need to know predictions. Who is going to win the division? We got a lot of change up going on in the AFC East. Who do you guys have winning the division?
Can I take the easy, the Bills? I'll take the Bills, the easy one, the powerhouse offense, the great defense.
Do they go past further than they did in playoffs last year, though?
Oh yeah, we're not. They have a history of not making it in the playoffs, so I guess we'll have to let that live.
Unfortunately, Bills fans know that all too well. But I don't know. I think I'm going. I'd love to go with the Patriots. Obviously, I'm biased, being former head team position for the Patriots, but Bills are going to be tough this year. They're bringing back a lot of weapons, and they've just consistently done a good job in all phases of the game.
Definitely. Von Miller coming back off the knee. Hopefully he can produce.
That's huge. And that actually was, and we, what's interesting is we predicted that. We predicted the Bills were, at the end of their playoff run is, once Von Miller went out, they had a couple other key injuries that started the slide downward. And, it might not always be just one injury, but it's the accumulation of injuries, the end of season stuff. And that's where a lot of our data shines in terms of how we can predict team's performance in the playoffs.
Ryan, what's your take?
I'm with Doc on this one, where I wish I could go for the Patriots, but they are not looking like the hot team in the AFC East anymore. Our 20-year reign might be over, unfortunately, but I'm going to stray away from the Bills pick and go with the Jets.
I knew someone was going to take the Jets.
He's a Hard Knocks fan. Huh?
Hey, you never know. The Bills might have too much confidence. Let that get to their head. They might not perform as well as everyone expects them to. And the Jets just might be riding their momentum all season from the offseason.
A couple good draft picks. They just signed some new folks we all know last week. So it's going to be amazing. I think, and I hate to say it, but health's going to matter in the AFC East big time because it's really tight. It's going to be one of the best divisions in football. We know we've got some not so good divisions out there, but it's going to be some pretty exciting football to watch. And it's amazing how the NFL comes in cycles where the Patriots domination was there forever and years and years and years and years. But you can see how it switches, and that's what I like. We all love that about the NFL. We love how it changes. We love how it might not be that next year or 3 years, but it's going to be a really fun thing to watch unfold. Is how the AFC, and I think it's really going to come down to injuries at the end of the day to see who really rises.
Tyler, tell us why the Dolphins are going to take it.
I did not pick the Dolphins, but hey, if the Dolphins did take it, it'd be because they have two fantastic wide receivers in Tyreek Hill and Jalen Waddle. And their running back core is, they have Raheem Mozart. They have I think Jeff Wilson, right? They have some veterans there. They have a good offense that could do it and a defense that can stick with them. But and plus, I mean, their coach is an amazing coach. But no,
And
unfortunately,
they got your mentor as an athletic trainer coming
Yeah.
up in the
they
world, right?
do.
Health
They
is
do.
definitely
And,
gonna
and I
matter
mean,
there with Tua keeping him healthy and on the field.
that's
Yeah,
true.
good point.
But they do have Tua, and as an Alabama grad, I'm a little biased on that. But I would unfortunately have to go with you guys with the Buffalo Bills. They just have too many weapons. I mean, Josh Allen, Stephon Diggs, Gabe Davis, tight end. They even have Dalton Kincaid now, who's everyone is pretty high on coming in as a rookie. They did lose Naheem Hines to injury for the season at running back, so that's something to think about. But with James Cook and Damian Harris there to back him up, I think they're in a good spot to do it again. And I love Ryan's pick with the Jets. You never know how everyone's going to click on a team when they're all new, and they have a lot of new faces on that team. So it's they're going to have to make sure that they come together.
We appreciate the support on the Bills.
Well, there you go.
We want to thank everybody.
3-1 for Bills and 1 for the Jets.
Some excellent do's and don'ts this week. Some great info on shoulder stability, and we're excited to get back on next week and keep on talking about health mattering.